My name is Phillip Ludkowski. I've been in the practice of orthopedic surgery for 3 decades. I specialize in surgery of the hip and knee. The common denominator with orthopedic practice and orthopedic surgery is that patients come to us more often than not because they're in pain. There's something that they can't do that they formerly could do. The challenge of the orthopedic surgeon is to make the diagnosis based on what the patient tells us, what the physical exam reveals, and maybe any subsequent testing. And then once that's done, we have to formulate a treatment plan, and it has to be a plan that is going to be acceptable to the patient. It's critical to have the patient's confidence and the patient's involvement because treating musculoskeletal injuries requires both sides. If I was the dean of the medical school that I went to, I would redesign the program and I'd put a little bit more emphasis on listening and communicating. The first time I saw an orthopedic surgical procedure, I realized that this was for me. My father was a carpenter craftsman and he had my brother and I using tools at a young age. My background is in athletics and I realized the importance of the musculoskeletal system, and putting it together, it was just a perfect combination. It gives a great sense of satisfaction because you can see the results of your treatment, and sometimes you can see it rapidly. The bottom line is it helps people. The Illinois Bone and Joint Institute is really a unique collection of very skilled and talented physicians. I have colleagues who have similar subspecialties as I do, and we meet and we discuss what works best, what doesn't work so good. We try to standardize our treatment plans because in the end, that's what provides the best care for our patients.